Hello, good evening. I'm Oral Gibbes, and welcome to Oral Gibbes Live. And with me this evening, I have a very interesting young lady, St. Martin, and honored to have her here in the program this evening. Is Dr. Bell. Good evening, Dr. Bell. How are you doing?
Good evening. Thank you for having me.
It's good to have you in the program, and it's always good to have our young people that went abroad and study come back and help build this island. So we're happy to have you here this evening.
Thank you.
You're welcome. So tell me, in St. Martin, most of the time we can't start an interview without first ask. People want to know, Bell. Bell is a big name. There's a lot of Bells in St. Martin. So if I don't start this program like this, asking you about yourself, they'll kill me tomorrow. So tell me a little bit about yourself.
I understand. My parents are Gaston Bell and Gloria Bell. People might know them way back when from St. Rose Hospital into St. Martin Medical Center, nursing and the lab. My father went on to do law, so they might know him from that as well. I was born here, grew up here, went to school, was the second graduating Physio class that we had on the island, and I went on to study medicine in Holland. And after medicine, worked in Holland, even came back here and worked on the emergency room for a short bit, and went back and eventually specialized in family medicine, huisarts, geneeskunde. And now I'm back on the island again.
That's good. So how many years you spent in Holland?
Ooh, a lot. I went up in 1993.
Yeah. Okay.
I worked on the emergency room here, I believe it was 2002. And I came back last year again in July. So
what is it like, being a doctor? Because, for a lot of people, it's a profession that we don't have many of, and you're required to go through certain classes. So, for example, you have to select the kind of classes you're going to need in order to go into medical school, right?
Exactly. Yes. Well, in my days, it was a little difficult, a little tricky,
really?
Because it was just the second Physio class. 2 years before that, you would have had to leave the island, actually, if you wanted to pursue medicine or do HAVO first and then leave to do Physio somewhere else. For instance, for medicine, there's certain subjects that you needed. I had those subjects, but then, for instance, I couldn't have biology, which is not compulsory to study medicine.
Okay.
But it would be great if you have biology, because that's one of the starting blocks for medicine. So that was an extra challenge for me when I went to study medicine, that I didn't have the option to do biology when I was studying here at Milton Peters College. You have to overcome that challenge then, because everyone knows the basics and you're still getting, you have to overcome that hurdle to move on from there. But I managed to get through.
And now it's changed now. Now they have all the required classes here in St. Martin, right?
So. I hope so.
Yeah,
I'm guessing they'll have more teachers, more hours. And
no, they have it now, because my second daughter is studying medicine.
Okay.
And she went straight into the University of Leiden.
Okay, nice.
Medical program. So all the required classes are now given in St. Martin, which is good. So, where did you study in Holland?
I did basisarts, so medicine, in Maastricht, Universiteit Maastricht, University of Maastricht, and a specialization to become a family doctor, huisarts, I did at the University of Leiden.
Oh, okay, good. So now that you're back in St. Martin, what's it like? Because your family practice?
Yes, huh? I have my own family practice in Kobe. It's the same work that I did in Holland after I specialized. There's some different challenges here. I won't get into too many details about the differences, but on the whole, the basic medicine is the same. There are certain things that we tend to see more here than maybe where I was practicing, depending on which area of Holland I was practicing in, and that has to do with different population groups, different age groups, etc. So the basic medicine idea. Family medicine is the same, but you tend to see maybe different things in a different balance here than back in Holland, depending on where you work, which neighborhood you work in.
Now, in St. Martin, in your practice, you see a lot of similar cases, say, diabetes, etc.?
Yes. Our background is Afro-Caribbean, mainly, on St. Martin. The whole Caribbean, actually, and other countries, especially the northern part of South America, think of Surinamese, Hindu Surinamese. We all tend to have a certain risk for certain diseases that are more than Caucasians, more than white-skinned people. And this has to do with our ethnic background, heritage. If you go back, way back, there are all sorts of theories, evolutionary theories as to why certain groups, ethnic groups, have developed certain diseases and risks more than others. This is all not too interesting for a patient to know. I think you should know more about what it is that you have, how it can affect you, and what you can do to prevent it, mainly. So.
And so when you look at, for example, you know, I hear a lot of doctors always say, well, men tend to go to the doctor when it's almost over. And probably it's true because when you visit a doctor, you see a lot of women there and very few men.
Yes.
Are you noticing that in St. Martin, that men are reluctant to visit the doctor?
The trend is the same everywhere, I believe. But I think it goes back to women being of a more nurturing, caring type of personality than men are. So they will quicker be the ones to accompany a child to the doctor, to be alert to anything going on health-wise, while men might be less prone to do that. So I think that's a trend you see anywhere, and you do see that here as well.
Do people say to you, but you're so young?
Yes, I get that a lot. I didn't get that when I was here like 15 years ago, strangely enough. But I do tend to get that now. I'm not sure why that is exactly, but...
Believe me, that's common. That's why I asked you that question.
Okay.
People tend to, and if you look too young, you know, they'll ask it, but they don't mean anything bad about it.
I hope not.
But you know, the thing is that when you look around the island today, you see a lot of people that when I was growing up, we didn't have that many obese people. Now I'm seeing a lot more youngsters, you know, and young adults obese. Is that a concern?
That is most certainly a concern. It's quite a large topic, obesity. Yeah. You don't even need to go all the way to obesity. There's a range before that where people are overweight as well, which gives you a higher risk at a whole list of health issues. Everything from the well-known things like diabetes, but also things like high cholesterol, hypertension, which give you higher risk of stroke and heart attack. Things that are lesser known, like infertility issues, for instance.
All that can come from that? Wow.
Higher risk of cancer. So it's a serious issue, and it's something that's preventable. So all the list of diseases and health issues I just named, by losing the weight, you can also reduce your risk, lower your risk of all of those things.
When you look at, take for example, hypertension, I'm surprised how many people I meet on a daily basis, and they'll tell me, you know, that they're taking medication for hypertension. You look at the people, they're not overweight or anything like that.
No, that's true. One of the main reasons, the main messages that I want to get out is hypertension. And the reason for that is because I've noticed it's quite rampant here. A lot of people with hypertension and undertreated hypertension. And what I mean by that is they're not paying attention to the hypertension. I'm not sure why that is, if they're not understanding the information that they're getting, or if there's another reason. But it's quite important. I think we would all think that if we can prevent something from happening down the road that's bad with our health, that we would want to do that, to make changes to do that. And hypertension is one of the easier things to understand, I think, when we think about prevention and preventing heart disease and stroke, which we see quite a bit here on the island. You think, okay, some of those things are difficult to tackle. The doctor might give you advice and you might think, oh my gosh, I have to change so many things. But hypertension is one of the easier ones to wrap your head around, to understand why it's so important. And with a few small changes, you can already get a large positive effect on your health. So I think it's one of the good places to start. If you're thinking, okay, I need to do something, change something in my health, that would be a good place to start.
And so that is what we call high blood pressure, right?
High blood pressure, yes.
And so does it matter the age of the person?
It doesn't matter what your age is. Maybe I should go back a bit and explain that you were talking about the Caribbean, people in the Caribbean, St. Martiners. We have a Afro-Caribbean heritage, as it were, ethnic background. With that comes automatically a higher risk of high blood pressure. We all know that if you have someone with high blood pressure in your family, your parents, your sister, your brother, that you're more likely to have a high blood pressure as well. But even people without someone in the family with high blood pressure, just because you have an Afro-Caribbean background, you already have a higher risk of high blood pressure. I don't think most people realize that actually. So it's important for all of us to be aware, be alert, and know what our blood pressure is to tackle that. It doesn't matter what your age is. Once you're adult, so over 18, 20, 21, it's something that you should start paying attention to, especially extra if it's in the family at a young age. But we do see among people of our background, and I've worked in Holland with groups of people that are, especially Surinamese, Hindu Surinamese, very strong risk of high blood pressure at a very young age, on early 20s on hypertension medication. So the question of age, it really doesn't matter. As we get older, our blood pressure tends to rise for most people. There is a small group of people, usually more in the slender range, as the body posture goes, that tend to get a lower blood pressure as they age, but that is a little more rare. It usually tends to go up as we age.
Oh, okay. And so when it comes to this hypertension or high blood pressure, you said earlier that it can cause, like, say, strokes. We've seen a lot of people in St. Martin now with that problem with strokes. Some people, they're not that old. They're in their early 30s, early 40s.
Yeah, and the reason for a stroke, blood pressure is one of the main reasons. You have other factors like too high cholesterol, diabetes. All these things have a negative, a bad effect on your blood vessels.
Okay. Doctor, let me ask you to explain, because I like my audience to understand. So you say cholesterol, what's that?
Cholesterol, the easiest way to explain it is a type of fat in the body, in your blood, that circulates. The most important thing to know is that if your cholesterol is too high, that fat in your blood is too high, that is bad for your arteries. You have to consider that if you have a artery, the blood vessel, so like a hose, the inside of that hose gets a plaque buildup of a layer that shouldn't be there. So instead of it being a perfect open hose, it becomes a much narrower hose. So you have less space for your blood flow, for your blood circulation. And you literally get problems with your blood circulation. On top of that, if you have a high blood pressure or sugar, you have added damage to the inside of that hose. And in your younger years, this is where the blood pressure is so important as well. You might not know. It's like buying a garden hose. When it's new, it's flexible and it can take a lot. You drag it around the garden and the sun and the rain, and it can take quite a bit. It can take a high pressure for quite a number of years. And then you start to notice the wear and tear on the hose. The same goes for our blood vessels in our body. It can take all the things we do to them, so the high cholesterol, the diabetes, which is high sugar, the high blood pressure, for quite an amount of years without us noticing anything. But at a certain point, it wears out. Your luck gives out, as it were. That garden hose has to be replaced. You notice it starts to bulge in certain places, it starts to leak in certain places, and that happens with our arteries as well. The pressure can make them bulge, or like I said, the narrowing means that you're not getting enough circulation to certain organs. That can be everything from your heart itself, to your brain, to your eyes, to your kidney, to your feet. And that causes the problems that you mentioned, that we well know people ailing, suffering from stroke and heart attack.
It's kind of scary when you look at it. I didn't realize that high blood pressure or hypertension is that dangerous.
It is, and it's one of the factors, and I think people are working quite well to bring awareness for heart and vessel disease, cardiovascular disease on the island. I notice a lot of attention paid to diabetes, less paid to hypertension, but it's at least as important as the diabetes, because it can lead to everything pretty much that the diabetes can lead to as well on its own without the diabetes.
Have you ever seen a patient that was diabetic without hypertension?
Yes, that's possible.
Okay.
That is possible. That is possible.
Well, I thought they went hand in hand, but it doesn't necessarily.
Not always. It doesn't necessarily go hand in hand. It is more likely because lifestyle plays such a big role in all those three things that we mentioned, the blood pressure, the high sugar, the high cholesterol. So usually if you're going to call it lifestyle, so your eating habit and not moving enough is playing a role with one of the three, it will also play a role with all three of them. And some people have the luck of good genetics, so they tend to have don't have a problem with the cholesterol as much, or maybe not as much with the blood pressure, because they've kind of inherited that a little bit within their family genetics. But you can have bad luck that you don't have that added advantage, and then you have a problem with all three.
And what about, does lack of sleep play any role in hypertension?
Lack of sleep can play a role in hypertension. There are many things that influence your blood pressure. The importance of blood pressure in the body is that it helps your circulation. It's how the blood gets around your entire body. It gets to the organs. It carries oxygen to all the organs and the cells in your body. So you need to have some blood pressure, but there's a range in which the blood pressure is considered normal, in which your body, your blood vessels, your heart are made to withstand that certain amount of pressure over years. If it goes above that, that is not for a short amount of time, the body can compensate for that. If it goes above that for too long, then it becomes a bit of an issue. Like I mentioned, the garden hose with wear and tear, that happens in your body as well. And when that happens, some of the factors that play into the blood pressure are, for instance, what we put in our bodies and what we do to our bodies. There's a couple of things, I don't know if you can let me mention them. I'll mention more factors than the one that you mentioned. One is, what we put in our body, salt, which is one of the most important, I think I can mention.
Salt?
Yeah, because I see that going quite wrong here most of the time. When I ask people about their salt intake, I hear, yes, but I don't use any salt. And then if you ask further, they mean the white salt in the food. But salt is more than just the white salt that you add to the food. It's everything that we use to season our food, actually. which I think is maybe, even if you just take this away from anything I say, would be maybe one of the most important things. So your seasonal adobo, badilla, the soy sauce, the ketchup, the barbecue sauce, the chili sauce, the hot sauce, mustard, anything you use to flavor your food usually contains a lot of salt, and salt elevates your blood pressure. It works on the kidneys. It causes your body to retain fluids, to retain water, and it carries up your blood pressure. So this is something that you should want to lower. There's a lot of hidden salt. Everything we eat, bread, crackers, cake, cookies, things that you might not think of as salt, pickles, ham, cheese, bacon, all of these things contain hidden salt. So we eat a lot more salt than we think every day, even though we're not using the white salt. So that's an important factor to mention. Then there's your heart health, your heart fitness level. That means more exercise. And I know nowadays us doctors advise, okay, if you're gardening or walking the dog, that's considered exercise, but that's not the exercise that is meant to get your blood pressure down, to improve your heart health. You really need to get moving to the point that your heart rate is up. Your heart is beating faster than usual. If you're not accustomed to exercise, go and get checked out by your doctor first to make sure that you don't have any excessive risks for doing strenuous exercise, and always start light and slow and then move up from there. So improving your heart fitness level, that can help. Another factor that I want to mention is the weight. We've already mentioned that, losing that can lower your blood pressure. That is a exercise as well, to keep your weight down or to lose weight, but also eating is portion size, portion size, portion size.
That's difficult. I mean, that's difficult because,
it's simpler than counting calories and trying to figure out what you should and should not eat. I'm not even going to go there because that's quite complicated, right? We'll all agree that it's not easy to do.
Yeah, because we speak about St. Martin in the Caribbean, and why I say it's difficult, because most of us tend to eat a big plate with a lot of food in it.
Yes.
We're not like the French, a little bit here and there, you know.
Deliciously flavored food with a lot of salt in it.
So I'm sure you're going to get resistance from us when it comes to that one.
Yeah, and I can understand that. We love our well-seasoned food, so I know where that's coming from. And the salt that I mentioned just now, if I say you should eat less salt, the things that I mentioned are not the only things that you can flavor your food with. You can use natural herbs, garlic. It might be herbs you've never tried before. You can experiment with ginger, coriander, parsley. The fresh stuff can be dried stuff, but make sure if it's dried mixes that there's no salt added in it.
But you have to learn. You're going to have to change your whole lifestyle and try to learn how to accept those things, right?
But that is, see, that's where the hypertension is easier than the diabetes. There you have to maybe pay attention to more things. And I want to try to keep this as simple as possible. So if you cut down slowly on the amount of salty, they call them the smack markers, the things that season your food. Cut down on them gradually and add in more of the fresh herbs, dried herbs, frozen herbs without salt to flavor the food. Your taste buds will adjust gradually. Because I know people complain, yeah, but doc, food is going to be bland, it's not going to taste like anything. I'd rather die than than eat food without salt. But if you, and this has been researched, if you gradually reduce the amount of salt you have in the food, your taste buds will adjust gradually, and you will not miss the salt as much as if you went from full salt to very low salt.
No, I agree, because my mother was diabetic, and because of that, she didn't cook with a lot of salt. So I was accustomed to eating rice without salt and food with very little salt. So if I go anywhere, I can taste it right away because I'm accustomed to that, not eating salt.
Yeah. Um, where the taste of salt comes into, some people they will eat out, and then you can't control, and you're not sure how much salt would have been put in the food, so that's something to look out for. If you're cooking at home, you know what you've added to it,
Right.
and you know that it's not just the white salt, but everything that you've added to it. And when you eat out, you might think, okay, this food from this restaurant doesn't taste so salt, but depending on what other herbs and flavors they've added in, it can mask the salt taste a little bit, so you can still be eating more salt than you think. So those are things to watch out for. If you want to be in control, you're going to have to do a little bit more yourself.
You know, you said something I've never heard from a doctor before. When I ask you about salt, and you said they tell you, yes, but not the white salt. And I'm curious here. In your practice, the first time you heard that was here in St. Martin in the Caribbean or in Holland?
No, it doesn't matter. If
Also
you
in
don't,
Holland, they will tell you that not the white one, just not realizing that it's all the different things that they put in it.
But I mean, really, it's difficult to know. You can't expect everyone to know everything about health, and this is one of the reasons that I think this is an important topic, because it's something so small and so simple that if people don't realize, really honestly didn't realize, and they think that they're eating low salt, it's such a pity. While someone just, had to tell them, well, it's the other stuff as well. And then it's up to you to do what you want with the information, of course.
But sometimes I hear people on TV saying, don't take the white stuff. The salt is dangerous, that's white salt. So they're misled too by people who don't know what they're speaking about. And then they figure, well, if I take the other things that are not white but it's salty, it's okay. It's not okay, right?
No. And nowadays you have all types of salt. You have pink salt from the Himalaya. You have, I don't know what else, colored salt you have. But salt is salt. Salt remains salt. One thing I should mention, if you're looking in the supermarket for products and you want to know, is it very salt or not so salt, you'd really have to compare. And don't do it in one shopping trip. Maybe just split it up and think, okay, I'm going to start with my seasonings and see if the seasoning that I'm using is quite salt or is it low salt. And you can start there. If you use a seasonal, so a season mix, a salt mix, you can compare one brand to the other and then see which one has in more or less salt. You might not see the word salt on the packaging for the amount, but you might see the word sodium on the packaging. And sodium tells you how much salt, as it were, there is in a product, and you can compare that. It's in the same section where you'd find the amount of calories in the product and the carbohydrates and the sugars. Right under there you'll find as well sodium, and that tells you how much salt is in a product.
Yeah, in fact, today I was watching TV and I saw a show where they were saying that, look in the package, if it's above 140, it's too much.
It depends on if you use the word salt or sodium. We mean the same thing, but in different forms, as it were. For salt in a day, it should be under 6 grams is preferred, a maximum for an adult. And for someone which would be the equivalent of 2.4 grams of sodium, so if you see 2.4 grams of sodium in total on a day, but you're not going to check everything. It's not the intention for you to go around checking and counting up. Absolutely not. You're not going to survive that. It's just to know, to be aware of the fact that not only the things that you think are salt, but all the simple, even your breakfast cereal and your sandwich for breakfast or lunch, the bread has in salt. We do need some salt in our bodies for our cells to function, but any excess is where the problem comes in. The American Heart Association, so when you're talking about people that already have high blood pressure, already have a known higher risk and are in a gray area, we want them to use even less salt if they want to prevent the blood pressure from going up any further. If they want to try to lower the blood pressure once it's already too high, then the border would be about 1.5 grams of sodium per day.
And does sugar play
in
any role?
total. Sugar in blood pressure, you mean? Sugar doesn't directly play a role in your blood pressure. It doesn't directly affect your blood pressure like salt does. But where sugar comes into play with your blood pressure is if you are eating too much sugar, you will gain weight. And weight, being overweight, directly causes your blood pressure to be too high in some people. Now, not every person that is overweight will have a high blood pressure, but it does increase your risk. And if you're overweight and you lose the weight, that alone can bring your blood pressure down. So that's another important factor that we had spoken about before already to look at.
So then some people say, the white sugar is dangerous. They're making everything white seems bad.
The white side?
White sugar is bad. Isn't all sugar?
Yes, the white sugar, and that's another, it's just typically as the salt. If you ask, people say, no, I don't use any sugar in my coffee or my tea, and I don't eat any cake. But everything that we eat, so especially the starchy stuff, so our bread, our sandwiches, potato, rice, pasta, all of that stuff, the minute you've eaten it, your body turns it into sugar. So it's the same if you've eaten too much rice and peas, your body turns it into sugar. So you could just as well as compared it to, I don't know by heart, you'd have to ask a dietitian to compare it to how many spoonfuls of sugar that would be.
Yeah.
But it's the same thing, actually. So even if you're skipping the white sugar and you're skipping the sweet stuff like the cookies and the cake, you're still, if you're overeating on mainly the starchy stuff, then I'm going to point out for now, then it's the same thing as eating too much sugar. And you'd gain weight, and that will negatively affect the weight.
So you're back on the island now for a while, and your practice, where in Cold Bay is your practice?
I'm located on the Union Road. If you're heading towards the French side, you have the plaza with the Friendly Island drugstore and the Orco Bank. I'm located on the other side of the road. I'm not on the roadside, I'm just a little back from the road, but I have a signboard on the other side.
The ticket calls are 54222170, 54222170. I've asked you a lot of questions. I don't know if I missed anything on the hypertension part there.
Yeah, there was one more factor that I wanted to mention, which is stress. It's something that I think in this day and age, most people will deal with at some point in their lives, whether it's a financial problem or a relationship problem with a spouse or in the family, or a child with health issues that you're worried about, stress at work, load being too heavy, or can't get along with the manager, whatever it may be, things that cause you worry and concern and that weigh on you. We call that stress. And stress is something that's known to be bad for your blood pressure. It can cause your blood pressure to rise as well. Now, if it's temporary, you had an argument with your neighbor about, I don't know what, scratch they left on your car, it will go up and it will go down again. That's normal. But for people that continuously live under a high amount of stress, whether it be from job or whatever else, even though you know that the stress is causing it, if you take the stress away, the blood pressure will go back down. Just the fact that they are living under the high stress for so much time, it counts just as any other high blood pressure.
Really?
And it's, yes, and it has to be brought down, whether naturally or by relieving, just getting rid of the stress, the issue that's concerning you. Sometimes we don't have control over the stress in our lives, then we have to try to manage the stress. So your work situation is what it is. You can try to maybe discuss the workload with the manager and see if you can reorganize it. Then you would definitely try that, but sometimes you can't. You can't manage to control the stress that lies, the cause lying beyond yourself. And then the advice is to try to manage the stress, what the stress is causing. So relaxation, breaks.
But some work we can't. And take, for example, this kind of work in broadcasting is very stressful, and the demand is to meet a deadline. And that in itself is sometimes almost every day for some people. This is, this field is very time demanding. You got to meet that deadline. You got to be here and there. It's very highly stressful work.
Yeah, and
you don't realize that.
There are a lot of fields like that, but it's been researched that people that work under frequent deadlines that cause more stress are more likely to have shorter lifespans than people that do not work under
so I'm going to live short.
So I would advise you to look at it and see, and I could understand your job remains your job, the stress remains the stress, but where you can find to manage to influence it in a positive way is welcome for your health. And if you can't, you have to make sure that you compensate with things that help relax you and load up your energy, because the stress drains energy from you, as it were. You have to find, whether it's going to the beach on a weekend or going for a walk or listening to music, looking at the view off your balcony, whatever works for you, talking to a friend. Those are things to consider, because it directly can negatively affect your blood pressure, can send your blood pressure up. And if you get rid of it, the blood pressure can go down. All of these are ways to, all the factors I mentioned, getting those under control, to get your blood pressure under control without needing medication from a doctor.
So stressful work is a big factor.
Is a very big factor in blood pressure.
But I look around, doctor, it's like almost everybody in Simran is stressed out.
I think it's a global issue at this point.
Serious, I go to places, sometimes you walk into a store or office and all the people there look stressed out. If you just say, they're ready to kill you.
Yeah. Well, I don't know, everyone will have their own story. Maybe you should ask them, how their day is going and why they're looking so stressed out. You might get the story behind it, and maybe it might make them smile, which will relieve their stress for a minute, possibly.
What do patients say to you? You ask them how they're doing? No, let me take that back a little bit. Let me ask you this. You go to the doctor. The first thing the doctor does, checking the blood pressure. Why is that so important?
For all the reasons that I just mentioned.
Right.
If your blood pressure is too high too long, it can it can damage the inside of your blood vessels. When it damages the inside of your blood vessels, it can lead to all sorts of problems.
So that's what the doctor wants to see when you first visit what your blood pressure is?
Yes, and the reason that it has to be checked is because even if you're feeling fine, your blood pressure can be too high, and that's one of the misconceptions. People think that I don't have any headache, so my blood pressure must be good. Only when I have a headache is my, yes, exactly. And that's not true. Blood pressure, you don't usually feel your blood pressure, so it can be too high for years, and you will think I'm feeling fine. So that's why it's important to actually check it.
Let me take a call for you, doctor. Oral Gibbes Live, young caller. Hello? Hello?
Dr. Bell, I appreciate what she's saying, and I congratulate her being a local doctor. OJ, thank you for that information. It's very, very important. And I would like Dr. Bell to talk a little bit, maybe not tonight, or you can have her another night, about thyroids, because that is so important. I, as a patient, got Graves' disease because of my thyroids, and a lot of people are not aware of the importance of thyroid disease, hyper or hypo. So I would just like her to talk a little bit about that. Thank you, and have a good night.
All right, thank you, ma'am.
Bye-bye.
All right, bye. Yeah, so that is something I noticed in Simran, and thyroid can affect even your vision. I didn't realize that.
Yes.
Until recently I met a person that had that problem, and they had vision problem based on the thyroid.
Yes.
Yeah.
The thyroid is a very important organ in the body. I don't want to say it's less important than hypertension or diabetes or anything else, but it will ail less people than the topics that we've mentioned so far. It is a very important topic for the people that have issues with the thyroid. They will know something about it, but it's important for you yourself to know if you have a disease as much as possible about it. if you have questions, ask your doctor directly, because what applies to one person doesn't apply to everyone.
Exactly.
And as she mentioned just now with the thyroid, you have that the thyroid can be overactive. It's an organ that's right here that most people don't even realize that it's there. You usually don't see it. And some people you can see it if it's enlarged. It can be overactive and it can be underactive. It produces a type of hormone, as it were, that helps regulate certain things in our body. If it's over or underactive, that can make you, for instance, feel quite tired. It can make you lose weight or gain weight, and a whole another array of complaints that you can have. It depends on which form you have, what type of treatment you need. You mentioned the eyes. People can have a severe form of Graves' disease, which you mentioned the name, where your eyes can be severely affected, and even a bulging can be seen. Some people even need surgery for that. So you're talking serious facial surgery to widen the orbita, etc. So it can be something very mild for certain patients to something that needs quite extensive treatment for others. And there are different forms and reasons for a thyroid problem.
And I thought it was only women, but men have that problem too.
Yes, men can have that problem too. You can also have you can have an infection in the thyroid. You can have cancer in the thyroid. So if you have a thyroid problem, or if you suspect that you have a swelling here that you're seeing, you can go to your doctor and they can examine you. They can look in your blood to see what how the function of the thyroid is, and then go from there and explain if you need any further investigations or if there's anything to be concerned about or not.
Let me ask you, doctor, about, I want to go back to the hypertension, high blood pressure. If you send a patient for a blood test, can you see in the blood test results if the patient has high blood pressure?
No. The only way to figure out if someone has a high blood pressure is to actually measure the blood pressure, which is usually done with a cuff around the arm. If we want to compare, and usually a doctor will not measure it just once, but on 2 or 3 different occasions, quite within the same period, to be able, because as we explained already, if you've had a stressful day, you've been rushing to the doctor's office, it can be too high on that day. But if at the other 2 moments that it is checked, it is well within range, then you don't have hypertension. It was just elevated too high on that day because of certain factors on that day.
What about the white coat effect?
The white coat effect is that's a quite interesting one. Let me see. To explain the white coat effect, white coat the word comes from a doctor having a white coat, which a lot of time they don't have anymore in all settings. But it's kind of a reaction that some people will get going to the doctor, white coat or not. It just got that name, that term. Some people tend to, whether you realize it or not, be maybe a little bit more anxious or nervous going to the doctor. And at the moment that the doctor checks your blood pressure in their office, the blood pressure is too high. While some people will know, well, they did it at a health check or the drugstore or at home, and it's normal. But when they go to the doctor's office, it's always too high. And those are people that we suspect might have white coat syndrome. So the blood pressure is only too high at the doctor's office because there's a certain underlying tension, whether they realize it or not.
They hate to go to the doctor. So.
There is a way to figure out whether it is or not. And usually we'll advise people to go and do a 24-hour blood pressure measurement, which is also a cuff linked to a little electronic device that you go home with for 24 hours. It keeps measuring the blood pressure every so much time, also while you're sleeping. And you go back, it's done through the St. Martin Medical Center, you go back, they read it out, and they provide your general practitioner with a result. And that result will show out of the doctor's office what your blood pressure is during a 24-hour period. And that will then help us to see if it's high in the night while you're sleeping, then that's definitely a high blood pressure, because it shouldn't be too high when you're resting at night.
Let me ask you, what's the highest you've ever seen a blood pressure?
Over 220, over 180.
Wow.
And that was not even necessarily on an emergency room, but that is quite dangerously high. And when it's that high, we're concerned that someone could have a stroke technically any minute. So those are not people that we will send away for a week or two and say, come back and we're going to check it. We want to check that maybe within a couple hours and give them medication for it, unless there is a very good reason that they can say, well, I just got in a car accident, I just had this serious fight with someone and I'm really, stressed out and angry or whatever. But if that is not the case and someone is calm and the blood pressure is that high, that's not good. So that's someone that you wouldn't necessarily need that second and third blood pressure to be sure that the blood pressure is too high. And then it just really is too high, and you have to gradually bring it down with medication.
So, Dr. Bell, a good blood pressure is what, 120?
For an adult, it should be under 140 over 90. That's a general rule. There are exceptions to that rule. If you already have cardiovascular disease, so heart and vessel disease, other problems like diabetes, you've had a stroke, you've had a heart attack, or you have related chest pain, you have a high cholesterol, all these higher risks of or already having cardiovascular disease, then your doctor might want you to be even lower than that 140 over 90. So they might request that you try to, your goal be to get your blood pressure, for instance, under 120 over 80, depending on what your cardiologist discusses with you. So that depends. And as we age, we have new research going on the last couple of years that we realize that when you're very, very, very old, so the 80 plus, the 75 plus, we're trying to see for the slightly younger elderly, that maybe we do need a slightly higher blood pressure, that we shouldn't aim for the 110 over 70 because it might not be enough pressure to get that circulation up to the brain. But those are things that are still being researched.
Now, I was speaking to an elderly gentleman a few months ago, and he was telling me his blood pressure was like normal. Really, really like 120 over 80. It's amazing. This gentleman in his 80s. You don't oftentimes see that.
Well, I wouldn't say we don't oftentimes see that. It might be a little bit more rare here in this population with our higher risk, and maybe, I don't know if we're doing our best to really keep the blood pressure under control. But you can live to a ripe old age with a perfectly fine blood pressure, but it depends on the choices that you make, the factors that we mentioned, so low salt, your weight, your heart health, low stress, all of these things, if you keep them under control, despite the fact that just the fact that you're Afro-Caribbean already gives you a higher risk, your family might have a higher risk. If you keep those under control, you can actually have a normal blood pressure.
All right, I'll take a call for you. Okay. Oral Gibbes Live, you're on call. Hello?
Hello, good night, Mr. Gibbs.
Good night, sir.
Good night, Dr. Bell.
Good evening.
I'm just interested, can I get your number, please, your office number?
Sure.
Yeah, you go ahead.
Okay, that's 5444 515. So 5, 3 times a 4, 515.
515.
5, 4,
Okay, good
4,
thanks.
4,
I just came in and I just saw the program and it seems very interested and I like it. And I'll check it out. By any chance, do you accept SVB?
Yes, I am contracted as a SVB general practitioner, family doctor.
Okay, thank you all.
Okay, you're welcome.
Thank you, sir. All right.
Welcome.
Okay.
Bye.
Okay, bye. So you see a lot of SVB patients also?
Yes, yes, I do.
One of the other problems is medication, taking medication.
Yes. What I see a lot of is people knowing that they have a high blood pressure and that they will have gotten medication from their doctor at some point, but would have stopped using the medication once that one box that they got prescribed finished, not realizing that they have to continue with the medication. Blood pressure medication only works as long as you're taking it. So if you stop using the medication the blood pressure goes back up sooner or later. For some people, they can be skipping one tablet. So if they come for the checkup and they already ran out of tablets for 1 or 2 days, on the day of the checkup, the blood pressure will already be too high, which is difficult for the doctor because then we don't know if your blood pressure is too high while you're taking the medication. So should we add on more medication? Or is it too high because you skipped 1 or 2 tablets? So it's always important to pick up your prescription before you run out so you can continue, especially when you're going to the doctor to check up the blood pressure to see if it's well regulated on what you're using. The medication has to be continued lifelong.
Hold that thought for me, doctor. I want to come back to you on that one.
Okay.
All right. Oral Gibbes live in call. Hello.
Hello, good evening.
Good evening.
I'm calling to ask the doctor if she does take the Nagico.
Yes, I am contracted with Nagico. So Nagico, Sagicor, all the SZV cards,
Okay, thank you.
as long as my name is on it as a doctor. Yeah.
Okay. All right. Thank you, ma'am. Okay. Doctor said lifelong. And then the other day I was watching my good old friend, Dr. Oz. You know, everybody here watched Dr. Oz.
Okay.
And one of the doctors was saying, you don't have to take high blood pressure medication all your life if you make changes, right?
If
but
you
some
make
people,
the changes, yes.
it's not the same, right?
So that's why that's why the message that I'm trying to get across is those factors, all those things that we mentioned a couple times now. If you can take control of those, you might not need the medication because nobody likes to be on tablets if they don't have
Right.
to. I mean, that's a general thing, especially here. If you don't want to be on medication, and we don't want to prescribe it if we don't have to, because every medication can have side effects potentially. For a small group of people, even though they do their best and they lose some weight, they lower the salt and they tackle everything, the blood pressure will still remain just too high. And in those cases, we have to wait. They have other risk factors. We have to give them medication. The doctor might have to add 2 types or 3 types to get it under control. Sometimes that's necessary, but you discuss it with your doctor and they will give you a best advice. It might not be what your neighbor is using or your aunt is using, because not everything works for everyone. But speak to your doctor and they can give you a good advice.
I smile when you see a neighbor. People here like to give their friends and neighbors the medication. That's dangerous.
I know,
Yeah.
but what in medicine the general rule is everything has to be tailor-made. So if you go to the doctor and you get an advice, it's based on your situation, your medical history, your medical problem, and it might not even work, the first advice, but then you have to go back to the doctor and get a checkup, let them know how it went, whether it worked, it didn't work, so they can adjust it. And not just because it worked for someone else doesn't mean that it works for you, because your biological makeup is slightly different than another person's.
Well, doctor, you know, we at a time, and a lot of people call asking if you take different insurance and where you're located. So maybe before you go, you can share that's one more time where you're located.
So I have my own family practice. I'm a house art, so general practitioner, family doctor, all falls on the same, so general doctor primary care. My practice is located in Colby on Diamond Drive number 1, which is if you're heading towards the French side on the Union Road. On the left side, you have the plaza with the Friendly Island and the Orco Bank, and I'm on the right side of the road. You turn off of the road. I'm there from 8 to 12 and 2 to 4 most days. Only Wednesday and Friday afternoon I'm closed. My number is 5444515. Did I forget to mention something? I take Nagico, Sagicor, Enya, SZV, all SZV, unless there's a different doctor's name on the card. So, but it's OZR, FZOG, SZV with my name on it.
Well, doctor, I want to thank you for coming in. I wish you much success and hope we can have you back again sometime here in Oral Gibbes Live, or speaking about everything, all right?
Okay. I would love to. If it could mean that I can help in any way, you know, health-wise, just let me know.
All right, thank you. We'll call on you again.
Okay, thank you.
Dr. Bell, that's it. I'll see you next time. Until then, good night. Take care. Bye.